There are 3 million Americans at risk of dying a silent death, and no one is talking about them. And they live in America's dead zones. What if your grandma had a stroke and no one knew about it? And she ended up dying because you couldn't even access emergency care even if you tried. These are places with no doctors, no hospitals, and no broadband. It's not just poor access, it's no access. Simply places in America where modern medicine doesn't reach and no one is coming. And there are over 200 counties in America where these conditions collide. These areas are scattered across Appalachia, the rural South, and the American West, and their zip codes are more predictive of their deaths than any diagnosis. 60% of these counties have no hospital at all. Many have lost their hospitals in the past decade. 17% of Americans still lack high-speed internet. This means millions of Americans are left to die in silence. Chronic illnesses like diabetes and kidney failure go unmonitored. Ambulance response times can stretch over an hour if they come at all. And mental health crises and substance abuse rates are going up in places that have no doctors within 50 miles. So how is it being reshaped? The federal government has created over 130 programs to help with this. The biggest is the Broadband Equity Access and Deployment Program launched in 2022. But even 3 years later, that law is still stuck in federal review. We have the money. We have the technology. What we don't have is the urgency and the accountability. This is not a rural healthcare crisis. This is a national vanishing act, and we're letting it happen. Do you know anyone who struggles to reach care because they live in a dead zone? Drop a comment, share your story, speak up for the people who have been erased. Email info@upichealth.com and follow UPick Health for more.